This morning on Today's Health, your smile. If you're like the millions of people who prefer to remain tight-lipped because you don't like how your teeth look, there are some new advancements in dentistry that could help. Dr. Nancy Snyderman is NBC's chief medical editor. Nancy, good morning to you.
Hi, Matt.
This is really incredible stuff.
There's some cool stuff
The first thing here, and this sounds weird, it's like if you're a parent, it's like having a spy in your kid's mouth if they wear a retainer.
I have 3 children. They've all been through braces, and my first did not like wearing her retainer, and she's paid the price for it. So for parents who are going to spend $4,500 for braces, this is a way to make sure your child wears his or her retainer.
Because the kid always say, yeah, I'm wearing it, Mom, I'm wearing it, and you know what? They aren't. Right, exactly.
So this is called the smart retainer, and this little blue sensor goes in the center. You can see it right here. It goes right in the middle of this retainer. And pressure on the roof of your mouth and heat and movement, it tells the doctor when you go back in for your checkup, he just puts it in against a machine, and it tells exactly how many hours a day your child has.
And so then you can say to Bobby or Billy or Susie, look, you're not doing the job. Yep. I'm not paying for it anymore unless you do.
And little Hamilton, who we just saw in that video, this is his chart for a week. And on Wednesday, he had a lot of tests. He was out of the house. He did not meet that red bar, which was the threshold, which told his parents that was not enough hours for the day.
What's this cost, by the way?
This costs about $100, which, if you're going to spend $4,500,
it's a drop
most
in the
parents
bucket.
Would say, go ahead.
This next thing caught my attention. It's called Teeth in an Hour.
Right.
And for people who need dentures, this could be revolutionary.
It's amazing.
But expensive.
This is about $30,000, will not be covered by insurance, but this is what happens. A CT scan of the face and jaw, and particularly the bone structure, is done ahead of time, and a template is made, and those holes represent exactly where the implant's going to go for the new teeth. Dr. Tom Balshi in Washington, PA, allowed us in his OR, and he uses that CT scan as a roadmap to make sure that the teeth he's going to put in are exactly where the normal teeth go.
So then you go into his office, he puts that over
he does it in the operating room in an hour. So right now it's almost like Legos. He takes that, he goes click, 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 and the patient walks out with teeth that really are a perfect match to what he had before.
You can eat with them and everything like that.
Talk immediately afterwards, and it's really an hour for uppers and lowers.
But $30,000 not covered by insurance. Maya is a lovely lady joining us this morning, and she's going to demonstrate what's called a Snap-on Smile.
Maya is one of these patients whose baby teeth didn't fall out, so she wasn't a candidate for braces, and she didn't want to have implants. So this is Maya without her teeth.
Can you smile for us? Can we get a shot of Maya's mouth there for a second? Okay.
Right,
you weren't happy with that?
Absolutely not.
Okay.
Snap them in.
You've got them in your hand there?
This is made of a resin, and she can not only pick the size of her teeth, but the shade, and helps with swallowing, speaking, talking, chewing.
Can you eat with those?
Absolutely.
Yeah, and I just heard them actually snap in as you put them in, and you click them in and out that easily.
That easy.
And after you brush your teeth, you can put them right back in at night and sleep all night, right?
Yes.
And how much are those?
These are about $1,200 to $1,600.
Thanks, Maya. That's nice of you to do that. Thanks very much. This is the last, but probably the most important.
Look, we can't talk about oral health without talking about the fact that cancers occur, and a lot of times dentists are the first people to see it. This is a brush test. It's a simple brush, and a lot of times what the first precancerous lesions in the mouth are little red patches or little white patches. This brush just literally brushes against those spots and is sent off to the pathologist. If there are cancer cells on this brush, it'll be picked up by the pathology lab, and they'll be able to tell your doctor that, in fact, you might have an early cancer.
And before this brush, the dentist would actually have to do a little scalpel thing.
Cut, sew up your mouth. This doesn't hurt. It's sort of like a pap smear, and it's going to revolutionize picking up cancers, because cancer of the mouth is one of those that if you catch it early, absolutely treatable and curable. 4
interesting technologies. Yep. Nancy Snyderman, thanks,
You're welcome,
Nancy.
Matt.
Appreciate it. Maya, thanks again wherever you went. She's off enjoying her smile.